Yes. Reading and writing letters backward is the main sign of dyslexia? No, it's not like that. Child's performance can be improved with extra classes, tuitions, hard work. Like I just said, that it's a condition, so it can be managed, but it cannot be cured. Gradually, as the child grows up, the problem will disappear and no support will be required. This could be true to some extent, because as the child grows, tries to learn on their own. So, gradually as they grow up, the problem might be a little different than it used to be earlier. Kids with dyslexia just need to try harder to read. Dyslexia is a vision problem. Sometimes, like I just said, there could be some other condition as well. There could be an impairment, but it is not the main reason that is why the child is having dyslexia. No, it's a separate condition. Dyslexia goes away once kids learn to read. Kids who don't speak English can't have dyslexia. No, it's not like that. It can be with other languages as well. Gender related? No, it is not gender is related, but yes, that is what the researchers say, that it is more prevalent in boys as compared to the girls. How can a regular teacher identify dyslexia? By observing the warning signs. When the teacher finds that the child is at par in all other aspects except the academic part, like the child is socially getting along with other kids is performing well in other co-curricular activities, but only not in academics. And watching the discrepancy. That is there any discrepancy? Is the level of the child below the grade? Screening program for children at early school years. Internationally, the age criteria for assessment is 5 years, but in India, according to the PWD Act, we have it at the age of 8 years. Before that, we cannot label a child. So in other countries, it is 5, but in India, it is 8 years. So the younger children can be put into a at-risk category and accommodations can be given to the child. Is dyslexia curable? Like I just said earlier also, it is a condition, so it cannot be cured. It can be managed through right intervention strategies. Now coming to the next condition, that is dysgraphia. Any challenge that a child faces in writing is known as dysgraphia. It affects the written expression skills. So these are the samples that I put in the slide. We can. So Johnson and Michaelberg, they mentioned the 3 main types of difficulties in written language. Disorder in visual motor integration, that is the handwriting difficulties. Disorder in revisualization, spelling disorders, and disorder in formulation and syntax, that is the written expression. The child is not able to organize the information in a proper way, right? So it will be disorganized. So these are the 3 main types of difficulties in the written language. So the writing is the most important skill, and when the hierarchy of learning, it is the last one to be learned. We begin with reading first, then we come to the writing part. So the hand of a child at the age of 3 years is not ready to write. In the first picture, we can see the hand of a 3-year-old child. The hand muscles are not fully developed. The strength is not there to hold the pencil properly or whatever, and the grip is not there. The grip is not proper. And the hand of a 6-year-old child, where the hand muscles are fully developed and the child is ready to write. Breakdown of the common pencil grasp types. So these are the different types of pencil grips. The first, at the age of 1.5, this is a cylindrical grasp. So they hold the pencil like this. 2 to 3, digital grasp. Then is modified tripod grasp. And the 4.5 to 7 years is the tripod. So these 3 fingers, this is the right tripod. the middle finger, the index finger and the thumb, with which the child learns how to hold a pencil or color. So these are the symptoms, or these are the signs that you will find a child having a difficulty in writing. Cramped fingers or unusual grip on a writing tool, odd wrist, body and unusual paper position. You have to remind them time and again that, tilt your notebook slightly or hold the paper or the sheet with one hand and then write with your other hand. Excessive erasures while very frequently, so they'll keep on erasing again and again. Inconsistencies, mixing print and cursive letter, they all often mix the uppercase and the lowercase letters. Slow or labored copying or writing, like we keep telling them again and again, jaldi likho, itna time laga diya. So it's the challenge that they are facing. They'll be very slow in copying down from the board. Misuse of line and margin, they don't know, from where to begin. Sometimes they will begin from the center, sometimes they will use the left side of the sheet. So you have to keep them reminding that this margin will be used to write the date. The middle part will be used for the content that we are copying down from the board, and like this. Frequent need for verbal cues, you have to keep prompting them, you have to give prompts, clues to them. Unfinished words or letters, such kind of errors are often seen in the notebook. So these are the few samples. The child was asked to write the action words. So the child has write a few words like playing, helping, flying, running, reading. So the child, although knows what are action words, but when it comes to writing, there are a lot of errors. The other sample shows a child who has a very weak muscle strength, is not able to exert much pressure on the sheet. The handwriting is so light, it's not even legible. This is another sample. If I had a magical cockpit, I would go to the Hawaii, the Philippines, and Mamas. Once I would go scuba diving, snorkeling, and swimming. Also visit. I'm unable to read this. So this is a handwriting sample of a child having a difficulty in writing. So the writing is almost illegible, very difficult to read. But yes, the child knows what to write. The knowledge is there. That is not missing. So proper way to teach cursive letters, always begin with the central ones. They are easy. This is easy for them to remember. Always begin with the center ones, then the upper ones having that curves and loops, and then with the lower ones. So these are different worksheets that are available. There are various resources that are there you can use, and you can make it interesting for the child as well. So the 881 or orange. So it's the same. The central ones, we are teaching the central letters, so the sentence is like that only. So you can use such worksheets. Classroom materials and routines, they play a very vital role. Even we also get bored when it becomes very monotonous for us using the same pen. So classroom material plays a very vital role, providing pencil grippers if a child has is not having a proper pencil grip. So pencil grippers play a very important role and can help the child write comfortably. Provide partially complete worksheets. See, you need to just keep making efforts. You need to keep encouraging the child to write. So partially complete worksheets play a very good role in that. If the child is reluctant to write, is not ready to write, so at least when they see a partially complete worksheet, they know, okay, I have to write one word or one sentence. So it's easier for them. It doesn't become overwhelming for the child. So once they know, okay, मुझे तो ये पूरा board से 5 or 6 sentences, I have to note it down in my notebook. It becomes very overwhelming for the child. Provide extra time to take notes and copy. Provide paper with different colored or raised lines to help form letters in the right space. So the classroom materials can make learning very interesting. The amount of information a student retains is directly related to how that material is presented. The teacher must examine the content of the course and choose the appropriate way of presenting the information in order to maximize both instructional and learning process. So keep your classrooms ready with such kind of learning materials which can be made available to the child. So I came across these two books. You can also have them in your school library. Writing Right. So teaching children about compassion, teaching children that it's very important to sensitize children about such challenges. When they are young, it is easier to help them understand that this is a condition. There is a new child in our classroom, and that child needs a little attention, little support and effort from all of us. And the children, they do understand. So these books, they really help them to understand what these challenges are and to be compassionate. The third condition is the difficulty learning mathematical concepts, that is dyscalculia. Types of dyscalculia. Dyscalculia is difficulty in mathematical calculations. Children with dyscalculia find it difficult to count, recognize mathematical signs. They often get confused with different mathematical signs. Generally, they mix multiplication and addition. They are very common. Calculate, confuse with numbers. So these are the sample pictures. So there is no proper procedure. They will start calculating on their own the way they understand it. Okay. So the number reversal is there. You can see. So addition and subtraction is the way they are understanding it. Characteristics and symbols, poor understanding of the signs, difficulty with addition, basic arithmetic skills, I would say. Poor mental arithmetic skills, may have trouble even with a calculator due to difficulties in feeding in variables. They might not understand 1 kahan hai, 4 kahan hai, because the numbers are very close and it might be difficult for them to use the calculator also. May reverse or transpose number, for example 63 for 36. Difficulty with conceptualizing time. The concept of time is very difficult for them to understand. Difficulty keeping score during games. Inability to comprehend financial planning or budgeting. If you give them some money and you ask them to calculate it, or you tell them to go to this shop and buy something and then tell me how much money you're left with, it would be difficult for them to tell you the amount correctly. Inability to grasp and remember mathematical concepts like rules, formulas and sequences. May have a poor sense of direction. So they often get confused when you tell them, okay, you go straight, turn right, then you turn to your left. So they'll forget it. They will have difficulty in understanding directions. The next condition is the autism or spectrum disorder. It is a condition which generally affects the communication. So the communication is missing, the social interaction is not there. And the basic signs are that there is no eye contact either, or very limited eye contact. There is no communication, there is a speech delay, playing in a very unusual manner, staying isolated, not getting along with others, and it varies from one child to another. The condition may vary in terms of, like, a child may not be able to regulate their emotions, and the child keeps on crying for the whole day. It will be difficult, challenging for the parent, for the teachers to console the child and understand what is actually bothering. So it could be because of numerous reasons. So, and it varies from one child to the other. So these are the symptoms: lack of eye contact, no or impaired imitation, no joint attention. You will find the gestures missing, like we express through our, the body language, the gestures, but you will find them missing in them. No pretended play, no social interest and social play, rare usage of language for social purposes. They will either point out what they want, okay, or they'll bring that thing to you and express what the need is, but there will be hardly any usage of language. So what are the odds? So again, it is about 1 in 36 in boys and about 1 in 144 girls. So more in boys as compared to girls. So major challenges: social communication, no or minimal eye contact, speak too loudly or too fast, difficulty sustaining conversation, difficulty understanding non-verbal cues. They won't be able to understand the social cues. Language impairment, ecolalia, they will keep on repeating the same thing. Whatever you are saying, they will repeat the same thing because the language delay is there, the speech delay is there. Difficulty with WH question, आप उनको पूछोगे ये क्या है, they won't be able to comprehend the question. So it will be difficult for them to understand. Difficulty with more complex sentences, trouble understanding humor. They won't be able to understand. If you crack a joke, you just share something funny with them, they won't be able to, express it. Restricted or repetitive behavior, hand flapping, very, very common. They do get fascinated with a lot of things. For example, there was a child I was working with. Child used to get fascinated with the ceiling fan. जैसे fan चलाते थे, so he used to, that back and forth movement was there. So then we made sure that whenever he's there, so we just switch on the AC. We will not turn on the fan because it was a big distraction for that child. Lining up items, like you ask them to play. These are the toys, so they'll just line them up. Need for activities to be completed in exactly the same way. Each time it will be completed in a different manner. It will not be the same. Needing some routine each day. Yes, it's a basic requirement. Then the transition is not that easy. If there is a change in routine, they really get disturbed, or they get impulsive. If there is a change of routine. So if the routine has to be changed, then it should be kept in mind that at least you keep it for 2 to 3 weeks and then you change it, because they are not used to that. So these are the major milestones that every child needs to achieve by the age of 5. Social emotional, follow rules, cooperative play, turn taking when playing, sings, dances or acts for you, does simple household chores. These are very, very important. Language communication, tell a simple story, narrates experiences, answers simple questions after reading a story with you, able to keep a conversation going. And cognitive, counts to 10, uses words like today, tomorrow, understands the concept of before, after, yesterday, tomorrow. Write some letters of their name some letters, numbers when you point out to them. Whereas if we compare it with a child having a learning challenge, especially a child having autism, many of the signs might be missing. Understanding sensory regulation difficulties. This is very, very important when you are dealing with a child with autism. They learn, they have these very, sensitive, I would say, sensory issues. They really get affected by it. Like many of them, they cannot tolerate bright lights. A very well lit room, they might not be able to focus. They might not able to pay attention to what you are saying. Some might have sensory issues related to touch, different textures, and you might find it strange also. Sometimes we feel like calling a child close to us, making the child sit near us, or hugging a child. But if they have a sensory issue, if it is related to touch, they might not be ready to come close and sit close to you. Some of them get distracted by the sound. Like I just said, the sound of the fan and the movement of the fan distracted that child. So they have these sensory issues, the smell. So the learning gets affected. The next learning challenge is the attention deficit hyperactivity disorder, ADHD. Very, very common these days, and new researchers, they tell us even it is prevalent in adults also nowadays. So it's there. So it's a challenge where you cannot focus on, concentrate, pay attention on a task for a very long time. A child starts with one task, is unable to complete that task, and switches to the next one. So it is a deficit which is related with the attention. And we all have an attention span of say 20, maximum 20 minutes. After that, we also need a break, a bio break, maybe a 5-minute break. And for these children, it is very, very important. And they have so much energy in them, and to effective intervention can only work when that energy is released. It is very important to engage them in some kind of outdoor activity like swimming, any kind of sport, swimming, badminton, basketball, so that that energy is released and they are settled and they are ready to learn. So it's a condition which cannot be diagnosed by any kind of test. It is purely based on observation. The classroom observation, the observation by the school counselor or the special educator, and through formal assessment where the psychologists, they observe the child, what is the attention span, is the child getting distracted, or there are any triggers that because these children also have some kind of behavioral concerns as well. We often say the child doesn't have the social etiquette, the child does not understand that the child has to maintain the decorum of the class. So you will find these things missing in the child. So there are behavioral concerns. Okay, so 3 core elements: inattention, hyperactivity, and impulsivity. So other elements that co-occur is ODD, that is oppositional defiant behavior. If you ask a child to do something, if the child asks you to do something and there is a refusal from your end, or you totally disagree or you totally refuse to do it, the child might get impulsive, might get aggressive. So it requires a lot of patience. You have to be very patient with the child. So it's negative and positive reinforcement play a very vital role here. So you have to tell the child, okay, first we complete this task and then we would switch to the other task like you just said. So we'll be working together on that. So here the motive is to make the child ready to learn rather than getting aggressive or impulsive. So these are some characteristics that you would find in children having ADHD. So learning challenges are also there. Conduct disorder, they may not be able to organize themselves properly. Anxiety and depression, they might be very anxious, and even things get overwhelming for them. So it shouldn't matter how slowly a child learns, as long as we are encouraging them not to stop. So what the children, they teach us is the hope to move on, the resilience, and trying in small bits. So it's the intervention plays the right kind of intervention plays a very, very important role. So these were the few learning challenges that I just discussed. Now we will discuss about the role of the school, of the special educator, the shadow teacher, and the class facilitator. The role and responsibility, exploring collaboration among teachers and special educators in diverse classrooms. So the children are blessed today that they have the shadow teachers available in the classroom, the class facilitator is also there, and they are also getting the support of the special educator. But it's very, very important that if all of them, they work in collaboration, in coordination with each other. Key roles and collaboration in inclusive classrooms. Class teachers create engaging learning environment for all students. Like if we don't require that there should be any kind of change in the curriculum or it needs to be modified. So the class facilitator is taking up the concept for all the students in the classroom. Then the shadow teachers provide individualized support. If you have a child with a learning challenge in your classroom, first of all, that challenge is being reported to maybe the coordinator, and then it is shared with the school special educator. Then on the basis of the observation of the special educator, the learning plan is designed. And the special educator is a common link between the class facilitator and the shadow teacher. So whatever the special educator thinks that will work best for the child, she is going to share it with the shadow teacher, and that is how the shadow teacher can proceed further. So the special educator designs tailored strategies to meet the diverse learning needs. Shadow teachers provide individualized support, facilitating student participation. So one-to-one support is being provided to the child. Collaboration among educators enhances students' success and inclusion. So we make sure that no child is left behind. Every child deserves a chance to be seen, heard, and understood. So collaboration strategies for inclusive classrooms. Role of class teachers. Class teachers play a critical role in integrating diverse learners into the classroom through tailored instruction and support. Involvement of special educators. So special educators provide expertise and targeted interventions to address the unique needs of the student with disabilities within the classroom setting. So if the special educator feels that this child learns in a better way through, by using a partially complete worksheet, let's initiate it like this way, moving on to independent writing later on. So the plan, the learning intervention is planned for a short period of time, say 3 months, 3 to 4 months, and then we see the progress of the child. And the shadow teacher offers personalized assistance, ensuring that students receive the necessary support to thrive alongside their peers in the collaborative environment. So whatever instructions, whatever interventions the special educator will share with the shadow teacher, she is going to follow that in the classroom and work closely and monitor the progress of the child. So importance of communication in education. So it is very, very important. See, initially when we have a child with a